Emerging technologies are transforming how healthcare is delivered. In physical therapy, AI powered tools such as ambient listening software, predictive analytics, and workflow automation are increasingly used to streamline documentation, support clinical decisions, and improve patient outcomes. But with innovation comes professional responsibility and risk. In this video, we'll be hearing the testimonial of a real Louisiana patient's experience when they learned their PT was using ambient listening tools during their treatment sessions. We'll also review some practical steps that providers can take to help ensure their clinics are adopting AI tools responsibly. There is no denying the promise of these tools. Ambient AI scribes are already being used in hospitals, medical offices, and some physical therapy clinics to reduce documentation time and ease administrative burdens. Yet the same tools that promise efficiency also raise complex ethical and legal concerns, especially when used without the patient's knowledge or consent. We recently heard from a patient who learned after the fact that her therapy sessions had been recorded by an AI tool without her knowledge. Her story underscores the real-world emotional, ethical, and legal consequences that can arise when patients are not informed about passive data collection in a healthcare setting. I've been seeing my physical therapist for years, 60-minute sessions once or twice a week for over 5 years. We built a rapport. We talked not just about my recovery, but about life. Family disagreements, inside jokes, vulnerable moments I shared because I believed those conversations were private. It wasn't until recently that I discovered, on my own, that our sessions had been recorded by an AI scribe tool without my knowledge or consent. Not just clinical notes, but full audio recordings, every personal comment, every joke, stored for a decade. And because with this particular company, the data is not de identified to protect me, my name and personal information hasn't been redacted, it can be associated with my medical record and even subpoenaed. I imagine sitting in a courtroom, hearing my own voice telling stories I never intended to be shared beyond that treatment room. What makes this even harder is that my physical therapist was excellent, truly the best I've had. I've seen multiple providers over the years, and no one else has helped my condition the way he did. I was finally making progress. I was genuinely happy, and now I've lost that. As AI tools become more embedded in practice, Louisiana's licensed physical therapists and physical therapist assistants must address critical ethical and legal considerations. How do we protect the privacy of individuals receiving care? How can physical therapists adopt AI in ways that maintain transparency, trust, and professional integrity? The current guidance seems to come back to a concept we're all familiar with: informed consent. In this scenario, the Louisiana patient's trust was lost, and the experience led her to discontinue physical therapy, despite her ongoing medical need. While the harm she experienced was significant, she ultimately chose not to file a complaint. My therapist is a great guy who is always trying to do the right thing. It made me realize how fast things are changing with new technology and tools to help him and other physical therapists. I really think that therapists need guidance, especially smaller clinics that do not have a compliance team or IT division that help them understand the terms and conditions of the agreement with AI companies moving into the healthcare space offering these services. Begin by assessing how your clinic currently uses AI and emerging technologies. Have open conversations with your team about transparency and patient consent. When considering adopting AI technology, work through these 3 steps. Vet the vendor. Do they comply with HIPAA? Do they allow the ability to delete patient data? Inform your patient. Explain how data is obtained and used. Offer them the option to opt out. Consistently review and update. Conduct periodic review of the tool and its updates. Revisit the use of the tool with your patients and reestablish consent. Implement these steps as a consistent plan. And most of all, remember that new technology doesn't have to be scary. We just have to know what we're getting ourselves into. Take your time and do your research.